this is Gianna Llanes. I am a TV news anchor, sports reporter, and beauty queen. And today I returned here at CSA Medical Aesthetics to update my face a little bit in that so that it's more camera ready. So I've been coming here ever since 2018, but the last time I came here was actually in 2022, and that's really because Doc Contessa's procedures have really had lasting effects on my face. But since I started a new job about a year ago, I think I've been getting a little less sleep, and that has had some effect on my eyes. So I realized that I kind of have problems with under eye circles and sometimes bags under my eyes, and my eyes tend to get droopy as well, especially when I don't get enough rest. So today we're gonna check out to see what Doc Contessa has in store for me to help that out. Don't forget to like this video and click that subscribe button as well.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a returning guest, Miss Gianna Llanes. Welcome back!
Thank you. Happy to be back.
Right. So it's been 2 years.
2 years.
Okay, but she still looks young and pretty, right? Okay. Now, I was assessing Gianna a while ago, looking at her upper third of the face. Main concern actually is the eye area.
Yes.
There you go. So, you know, over time and with Gianna, her type of job, like she's overworked, sleepless nights.
Yes.
Ayun. So she'll have these concerns of under eye problems. So like a sunken or hollow under eye, dark circles. And then also over time, the temple region, we lose volume there. And then as we lose volume here, the upper third, the upper eyelid or the eyebrow may droop down. Is that the concern?
Yes, that's exactly the concern.
Yeah. But so far, I love your V contour, the cheek contour, it's still beautiful. Yes. She has like overall, super beautiful. So we do procedures that are really to maintain the good skin quality, plus the tightness of and firmness of the skin. Whether we like it or not, on a daily basis, there's what we call natural aging and plus deterioration of your protein collagen in your skin. Like in our textbook, I said, I think it was 1 to 2%. 1 to 2% of like protein denaturation on a daily basis. The good thing with our body, it is also able to renature or regenerate. However, as we age, that process of regeneration, it decreases. So it's like going into like production is decreasing, but the breaking down, the degradation is also increasing. And I was saying, oh my goodness, why is aging like that? Aging, you're so unfair. So what's happening is like your skin has some enzymes that breaks your collagen and elastin. We call them MMPs, mga kontrabida ng skin yan. Matrix metalloproteinases, as we age, they become more active. So the more collagen and elastin and protein, they'll break or they will degrade. And then, the ones that produce the new collagen and the new elastin, they're also decreasing. So yun yung tinatawag na yung mga fibroblast cells are kinda becoming deactivated. And the aging process is accelerated, of course, when your lifestyle is, overwork, like lack of sleep, or like those with unhealthy diet. So some people are into salty, fatty, junk foods. Nagchichichirya ka pa ba yung mga potato chips?
Minsan.
And sweets. Yes. Like so much of the glucose, the simple carbs, the sugars, Okay, there's this so-called AGE products in our cells, advanced glycation end products. So when there's an increase of those simple sugars, glucose, fructose, inside the cells, they kind of like cause also the increase in those enemies of the skin, yung mga MMPs, even though yung mga chromosomes na shorten ng telomeres because of too much of those sugars in the body. And they stimulate a lot of inflammatory processes because we don't want too much of inflammation in the system. So, these are bad, like inflammatory molecules are bad in the body. They will accelerate the aging. So, yon. So, we've mentioned yung lifestyle, yung lack of sleep, overwork, overfatigue, unhealthy diet, ano pa ba? The others, like, of course, they smoke, they drink alcoholic beverages, those factors, or no exercise. You have exercise.
I do exercise.
That's a good thing about you. Yeah, lack of exercise. They'll accelerate the aging process. So, guilty tayo doon sa sleepless nights.
Yes po, kasi late
Yan.
natatapos yung show ko. It ends at
I
10:30,
understand.
so
Yeah.
I end up not
And good thing we have
having
science.
sleep. We have
Good
science.
thing we have anti-aging remedies right now. Okay? So, we'll do that procedure for Gianna when CSA Medical Aesthetics return. And we're back. So, we're doing under eye treatment for Gianna. At the same time, like a lifting treatment for the upper eyelid area. So, for the under eye, the concerns of dark circles, hollowness, okay? So, we'll be using our polydioxanone threads, okay? We've done that before, Gianna, right?
Yes.
So, like 2 years ago, like we use all those polydioxanone, multiple strands we've placed like in the dermis and subdermis layers. So right now, we'll be using it for the under eye region for revitalization. So initially, you have to make an entry point. So it's gonna be here in the inferior aspect of our lateral canthus. So just a tiny prick there with your lidocaine. And here is our gauge 21 needle for our entry point. And then I'll be using the so-called dermaspring under eye PDO threads. Okay, so I'll place a sterile gauze under that. So now, ideally, this PDO thread we place in the so-called subdermis layer where we have those fibroblast cells. So I'm just gonna advance it in that layer. So I'll just be gentle, Gianna, okay?
Yes.
It's like a sensation lang ng pressure and even some like sharpness that's normal, okay? So I'm just gonna glide it gently, okay? Ideally, you can place this in the deep dermis and subdermis layer because that's the tissue layer where you have those fibroblast cells. Okay, so I have a second dermaspring thread. So it's just a monofilament type of your PDO. We use this for those with thin skin, okay? So just a sharp sensation there. I know there's a feeling of, I'm going already in the retaining ligament. So for this one, we want to reach the retaining ligament, especially in the middle area. Yeah, I do understand the feeling because we're just using a single entry point and it's like single filament for each cannula here. So I'll just glide it, advance it towards the medial retaining ligament, okay? So glide it again. So we want these strands of threads to be not so visible on the surface, okay? We just want to maintain the right anatomical tissue layer. And we're going to the fourth one. So the placement is like a fanning method. So the thickness of this thread, because we have some threads with different kinds of thickness. So this one is like in the 6/0 thickness. So those who are asking like how thick the thread is, so actually we have 4/0, 5/0, and 6/0. So like imagine the strand of your hair, it's even thinner than that, okay? So these are absorbable suture threads. We leave them in the skin tissues to stimulate the so-called collagenesis, okay? So now I'm shifting to a shorter type. This is a gauge 30 25 millimeter, and I'm using the same entry point to strengthen the inferior aspect of this lateral canthus, or the so-called lateral or palpebromalar groove. So just 4 pieces of this one, to help tighten this area, but I'm just gonna be in a fanning technique here. So meaning to say, the fanning method is like a fan shape, or those, what do we call that, Gianna, when it's hot? Pamaypay.
Pamaypay.
Yeah, fan shape technique. Okay, I'm just gonna advance it a little bit. For those with lines under the eye, this is also what we use to treat those so-called infraorbital wrinkles. Because some patients are not into receiving Botox for their wrinkles. This is also an alternative to Botox. Okay, so I've done those mono strands. Now the tear trap section, we want to correct the volume loss there with the so-called scaffold type of thread. Okay, so I can measure this scaffold, like usually this is a 60mm length. Okay, this is just a one type of PDO thread again, and this is my entry point. I'll be more lateral compared to the first entry point. Okay, so we're just using a single of my scaffold. So when you say scaffold, these are like multiple strands of polydioxanone threads intertwined in a single cannula. Okay, so we love this because it has more of a volumization effect. It restores the volume that was lost. So we want it in this entry point here. Okay, so we'll just glide it. So this is a gauge 21 cannula. Okay, I'm just gonna glide it in this tissue here. Okay, just a deep tissue. Inhale, exhale, and I need to reach that tear trap section. So just some advancing pressure there. Okay, we're being gentle there, and we're already in the medial retaining ligament. I'll press it and pull out. Okay, sorry for the pressure. There you go. So that's it. Just one scaffold, it's fine. So now we'll also do the so-called lifting of the tail of the brow, or the upper eyelid area, especially the corner of the eye, because we notice over time it's kind of like it will become droopy, right, Gianna?
Yes.
So to give us that, like, you know, open eyes, or rather revitalized eyes, not looking tired all the time. Okay, so I'll make an entry point injection here. This is just a lidocaine. Okay, first lidocaine injection. Okay, that's the entry point. Now I need to make those like a space for the cog thread that we will use to pull the corner of the eye. Okay, so just linear threads of this so-called lidocaine solution. Usually my lidocaine, I mix it with NSS to kind of balance or with sodium bicarbonate to balance the pH there so it doesn't sting. So we call that a tumescent solution. So with your lidocaine, you can add your sodium bicarbonate to balance the pH. Now this is the first cog thread. This is a spiral cog 60mm in a gauge 21 cannula. I'm just gonna glide it in the subcutaneous layer here. Okay, now we have to reach the scalp region. This is like an anchoring area here to really have that good pull. Okay, so it's normal to feel like parang your hair is being pulled, or in Tagalog they say nasasabunutan in Filipino. Okay, I'm just gonna glide it in the scalp region, and then once I'm already there, and we'll pull it out. There you go. And I will create another like a space for the second cog. So this is again your tumescent solution, your lidocaine. You can mix your lidocaine with NSS as well as your sodium bicarb. So we recommend using lidocaine with epinephrine to kind of also help in vasoconstriction, so not much of a bleeding in the area. Okay, so I'm again injecting a lidocaine in the region, and then a second entry point. So I'm in actually the tail of the eyebrow area. Then the third one will be at the so-called arch of the eyebrow. Okay, so normal to have some, like when you prick the skin, it's normal to have some pinpoint bleed, you know, because we have this so-called hypervascularity also. Okay, in this area we have some sentinel vein, that's normal. Okay, I'm just gonna glide it in the sub-Q layer. Okay, so almost in the scalp region, and just anchoring it. Okay, there you go. So it's normal to feel some tightening already or like lifting. And this is the third one. So after I do this so-called cog lifting on the tail of the eyebrow or the corner of the eye, we'll proceed with the NCTF. So we use now NCTF for concerns like dark circles to help in depigmenting or lightening the area. Okay? It contains micronutrients, some amino acids, aminopeptides, and other like multivitamins and some minerals. Okay, our skin also will need micronutrients. These are cells that will need also food, right, Diana? So the cells will need energy sources. So we get them from the food that we eat. So we also have injectables, the food already ready for the skin cells, like directly giving it to your skin cells. Okay, so now this is my third cog thread for this side here, like a tiny prick. Okay, so we'll just glide it in the sub-Q layer here. So we want the PDO thread to be placed in that layer where we want to stimulate our own fibroblast tissues. Okay, so just gliding it through the soft tissue layers here, and we'll pull out and we'll just cut these threads, the threads that are out. And PDO threads will help in tissue regeneration. So we have right now in medicine the so-called regenerative medicine, whereby we use materials like polydioxanone to stimulate regeneration. So instead of degeneration, we'll just have the regeneration. Okay, it's like reversing the aging process. So for this NCTF, so it's a micronutrient. Now for this one, we deliver it intradermally. So when you say intradermally, the injection is like creating papules. It's more of a papule technique. I'll start on the periphery. Okay, this part here. So delivering food directly into our dermis cells. Okay, because our dermis is actually the vascularized layer of our skin. And this is the layer whereby we have defense cells. We have our, like for example, macrophages or even other protective cells. Okay, we have the fibroblast cells. Okay, and like in the epidermis, we only have like your keratinocytes, your corneocytes, okay, basal cells, spinocells, granular cells, and they contain proteins also. So keratohyalin granules, keratin protein, and we remember keratin is significant in as a protective layer in our skin because it traps, you know, it's like the barrier for the skin, and we need those molecules that will trap water. So we can also inject on the sides of the eye here for the skin nutrient. Okay, so again, this is NCTF. We inject it intradermally, and when you say intradermally, you're creating like micropapules or papules. There's also like a pimple papule, remember the papule of pimples. Okay, we'll also inject upper eyelid area to help brighten the skin here. So we want the skin to improve, you know. Well, over time our skin kind of also gets tired of like, well, if you're into your industry, you put on makeup too, right? Mm-hmm. So the makeups that we put, like they clog the pores, you know. So just a little bit on the upper eyelid. And that's it. So let's transfer to the other side. So we are now giving the NCTF to improve the skin texture, color of skin, quality of skin. This is NCTF. We'll show the result to Miss Gianna when CSA Medical Aesthetics return. And we're back. So let's show the result to Gianna. Here's our mirror.
Oh, wow.
Right? So we noticed already that lift, especially on the corner of the eye, like giving that cat's eye or fox eye lift. And then in the under eye region, we noticed already stretching of the skin. So like a slight reduction in the pigmentation. We have some like tiny dots there because of the NCTF injection. It was in a papule form or like a wheel form or like a tiny bleb. But within the day, it's gonna clear up, it's gonna flatten, okay? And usually the next day, you may feel some tenderness there. And then second day, third day, then improvement in the soft tissue swelling. And then usually PDO threads, they start to stimulate collagen synthesis on the 4th week up to the 12 weeks. So this is like a gradual improvement and a gradual reduction of that darkening under the eye. We love the PDO because apart from collagenesis or neoelastogenesis, so many terms, neovascularization, it has an effect of brightening and it stimulates like growth factor peptides for further repair in the skin layer. Comments, Ma'am
I
Gianna?
love it. I'm so excited for it.
Your eyes
also
open
to
up.
fully, yeah, my eyes open up. I feel like it's also perfect for my face
I know,
shape.
right? Yeah.
So everything
Correct.
is just like lifted.
Right. Yeah.
It has that effect, and
I
I
know.
love it. Thank you.
We'll just
po.
wait for the healing of those injection marks. Take note, we did a lot of injections, right? And there were like multiple strands, like those derma spring threads that we've used. The derma spring, it's also coiled around the cannula, okay? So we left it in the dermis, subdermis layer, together with that short gauge 30, 25 millimeter, and then also a scaffold in the orbital retaining ligament to restore that support in the infraorbital region. And then again, as I always say, over time, you'll still see more improvements, the tightening and firming effect. And we're regenerating instead of the daily degeneration.
Yeah.
Diba? The one I was talking about, like protein denaturation on a daily basis na 1 to 2%. So let's reverse that. Let's just age backwards.
Perfect.
Minus na lang yung mga edad natin. Yan. Bata pa si Gianna, she's still young eh.
Yes.
20
29,
Oh,
feeling
yeah.
18. Looking
Actually, she looks a lot younger. She doesn't even look like she's saying she's 29. Pwede pa ang 18 eh.
I'll take
Right?
it. Thank you.
So just maintain it.
yes,
Yeah.
po. Yes.
Ano kasi yung may saying eh, yung when you're at this age, it's a gift from God when we're young daw.
Yes.
But when you reach daw 40 and you beautify yourself, it's your gift for yourself.
Yes,
Yeah.
yes po.
Kasi,
I also
yeah.
remember you told me before that it's better to start when you're younger so that
Correct.
when you're older, you don't have to look back at it. You don't have to
Exactly.
feel the effects.
Right.
na.
And you don't need more procedures kasi the older
Yes,
we get,
yes.
multiple treatments and even surgery.
Yes,
Yeah.
po.
Start early. Thanks so much.
Thank you
you so
much.
much. And we're just glad to have Gianna again. We know she's so busy and we're of course so happy for you. We're glad that you, in your career you're succeeding, you know.
Oh, thank you.
And maybe in the future we'll hear some wedding plans. Okay, just a joke. Okay. So thank you. God bless you.
Thank you po.
Okay.
Thank
So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Gianna, pwede ka ba nilang i-follow? Baka at ano ba,
syempre
Instagram?
po. Of course, you can check out my Instagram and
Yan.
my Facebook, even my TikTok. It's at Gianna Lianes. Kung may mga tanong rin po kayo tungkol sa procedures, like the after effects, the pain, just let me know. I got you.
Yeah.
I get that question a lot, and
Correct.
it's not really painful.
And please do watch the previous videos We had an episode in the past, so just like look at our YouTube channel, Contessa Salvador, and do subscribe. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.